Facilities are strained with COVID-19 related cases, and the number is growing. A total contrast to the situation just 1 month ago, when even some medical experts believed that the worst was behind us. Instead, the nation is confronted with a worrying positivity rate that has stood at 22% for 2 consecutive days, and a death rate of at least 1 person every hour. Now, the big questions: just how did we get here? Is this a new variant of the virus? And is the vaccine the silver bullet in the face of this unpredictable pandemic? At this time, we'll be speaking to the experts, Dr. Lois Ombajo, an infectious disease specialist at the University of Nairobi and the Kenyatta National Hospital, and in studio, Dr. Richard Aya, who is a member of the National Task Force on COVID-19 vaccine deployment. Remember, send in your questions. 22422 is the SMS line, and the hashtag is NEWSNIGHT. I believe we actually have a few tweets. I know some of you are already sending in your questions. Can we be able to take a look at them now? All right, here they are. This is what Kenyans are asking tonight. Engineer Lazaro Kanyambok is asking, why is the positivity and mortality rate shooting up only after the arrival of the vaccine? Why can't they counter-check how safe we are with the said vaccine in our bodies? I'm sure Dr. Aya will help us with that one. Okay, let's take a look at another one. Remember, you can keep sending them in. Bernard Kipruto wants to know, I've had some people say that during this new wave, some people don't show serious symptoms and then they suddenly succumb to the disease. It seems highly unlikely, but wanted to check if that is possible. Okay, Bernard Kipruto, thank you for that. Another one, I think we'll take another 2 more, or is it 1 more? Okay, Ian Bissett, have you been able to establish the cause of the bad flu and cough with children, especially those from school and their parents? Are there tests that we've been able to run, and have people been discovered to have COVID-19? Okay, I think there's one more. Right, there is. Let's see. This one coming in from David Deda says, what is the efficacy of the vaccine if at all the virus is presumed to be mutating? And why should already vaccinated people still get infected? My guests will help to explain all that. Earlier on, I was speaking with Dr. Ombajo. As she thinks about those questions, let me introduce Dr. Aya, who's here with us in studio. Richard Aya, a member of the National Task Force on COVID-19 vaccine deployment. May I also add, he was the 8th Kenyan to get the vaccine. The elephant in the room, Dr. Aya, tonight, how are you feeling? It's been almost 2 weeks for you, I bet.
Yeah, thank you very much for inviting me. Yes, it's been 2 weeks and I'm good.
You're good. No,
yeah. I mean I got it. I mean the first day, the little prick. I'm somebody who I think I'm scared of needles.
You got it on the Friday.
I got it on the Friday on the first day. A bit of tiredness on the second day. This arm, I couldn't do any weightlifting, but after that, everything's been fine.
And it's been fine ever since. There are people in this studio who've been asking me many questions before you. So I hope your words will assure them. So where are we with vaccination? What are the latest numbers for the country?
So as at today, there's been about 55,000 people vaccinated. The rate now today, I think there's about 9,000 people vaccinated. The numbers are doubling every week. So the first week, there were about 3,000 that were done. The following week, about 4,000 per day. Now we're at 9,000 per day. So the numbers are going to double every week. The facilities as well are going to double every week.
Before I allow Dr. Ombajo to weigh in, break this down for us as simple as possible. What happens scientifically when you take the first dose? What is your immunity level like up until when you take the second dose, and what happens thereafter? Trevor Mbija tried to get into this yesterday, but it was still very confusing for many of our viewers.
Okay, so so you get the first dose, say today, and it takes about 3 weeks for your immune system to be up to scratch. So what happens is that the vaccine enables, gives a reaction to the body, and your immunity builds up. And after about 3 weeks or 21 days, you're going to have a protection level of about 75 to about 80%. Okay? Now, the vaccine that we have, which is the AstraZeneca one, the longer you stay between the first and the second dose, the better the level of protection that you're going to get. So in Kenya, we're looking at 8 weeks. So 8 weeks later, you get your second dose. And now your protection level will go up to above 90%. Now, there are 2 aspects to it. The first is that even after the first dose, for those who are going to get the most severe kind of illness, the kind of people we're seeing landing in ICU and so on, the protection levels are 100%.
Even after the first dose?
Even after the first dose.
And after 3 weeks, because that's the time it takes?
Yes. So you have 3 weeks in which you need to take care, and it reduces the levels of severe disease. However, you can still get the mild and moderate disease. So the second dose helps to protect against that, and also helps to protect against transmission. So those are the two critical bits that we have to take into account.
Okay, I know there are some viewers asking how, and I'll give you a chance to respond to that shortly, but let me allow Dr. Mbajo to weigh in. Any response as we've got into the vaccine discussion, Dr. Mbajo, and also there are those questions from our viewers. I don't know where you want to begin.
Okay, so let's start with the questions from the viewers. Sorry, I'm getting a lot of echo. I don't know if you can use that a bit.
We can hear you. Go ahead.
Okay, so if we start with a question around whether someone just drops down dead and they were previously well, there was a question of does it progress that rapidly? So we haven't seen cases where someone is totally well and then they just drop down. Often people may have had some initial symptoms, and some of the initial symptoms you see are things like cough, they may have some sore throat, some may have some fever, and those who are going to get more severe disease may then begin to have difficulty with breathing. They may begin to feel like they're not getting enough air and they're breathing a little faster. Some may have some chest pain. At this point, often if someone is in hospital and we check their oxygen saturation or how much oxygen is being carried in the blood, then we see that that is low. And that basically shows us that there's more involvement of the lung. And at that point, we may need to put someone on oxygen. And depending on how severe it is, some may require to be put on a ventilator to help them breathe. And that's a point where a lot of people may then struggle, and that's a point where we tend to see death. Occasionally, we know there are certain things that may happen with COVID. For example, people may get a little more clotting. So some people may get a clot that if it goes to the lung, that may cause death as well. But often someone has had some illness. So it's rare that someone who was totally well suddenly drops down and that's it. There was a comment about we have this virus that's now moving straight from the tip of the nose into the lung. So generally, a lot of the infection tends to happen along what we call the lining of your respiratory tract, all the way from the nose to the back of the throat and into the lung. So that would sort of be the path that it moves down towards the lung. And we haven't really seen a difference in presentation with this current wave compared to the previous waves.
Okay.
You may need to remind me of the second question.
Okay, maybe one other question that's coming up quite a bit is, and I know it's a hard one to ask, should Kenyans begin thinking about the possibility of another lockdown? And I'll give you examples. In the United Kingdom, we're hearing that possibly over the Easter period, those 4 or 5 days, they could lock down to prevent people from traveling. As you assess the situation, has that come to mind?
Yes, that has come to mind. I think for me as a Kenyan and for all the other Kenyans, we have to think of what is it that a lockdown achieves and where are we as a country. And the truth is, at this point, in many of the areas, for example, in Nairobi, we are not in a very good place. We have a lot of infections. We have a lot of people getting sick. And as we said, we have very high positivity rate in the community. And that is something that's not just being seen in Nairobi, but in Nairobi, in Kiambu, in Nakuru, Machakos, and Kisumu. Those are some of the counties that are seeing a high number of infections and high positivity rates. So what are some of the things we can do to reduce transmission and reduce the number of people who are sick and reduce the pressure on hospitals to manage those who are sick? And if we think about it, one would be to go back to the basic prevention measures. So everybody must wear a mask. Then we have to go back to the basic hygiene measures. We must wash our hands. But even more important than those, we have to begin reducing gatherings. So all those family gatherings, religious gatherings, and any other gatherings in situations where people are unable to maintain social distancing, are unable to wear masks, are things that we must stop now. And if this continues as is, then we have to think of a point of how can we even reduce contact between people further. And one of the ways to do that would be to begin having restrictions around how much we move around, how much we interact with each other. And we've seen a lot of countries that are battling with significant increases in number of people getting infected, actually impose lockdowns where people are only allowed to move for emergencies and other very essential movements. And I think as a country, we really have to think about what would be best for us in terms of reducing infections. So that's something that I think every Kenyan needs to start thinking about, so that if need be, that's a direction that we may need to go.
Dr. Mbaji, is beginning to feel a lot like 2020 again, and we had hoped we were past the worst of that. Be on standby. I have a few more questions for you, but I also have Dr. Aya here with me in studio, and he is a member of the National Task Force on the COVID-19 vaccine deployment. Dr. Aya, a bit earlier on, you were talking about how after you take the first dose and 3 weeks, the possibility of you getting a severe COVID attack lessens dramatically, but also the chance of you passing on COVID should you contract it also goes down. How does that work? That doesn't quite make sense. Could you have COVID and not be able to transmit it to others?
Well, you shouldn't. So you get the vaccine today. Now, the 3-week period, the 21 days, is when your body is building up immunity. So it is possible during those 21 days for you to even get COVID. Okay, because your immune system
within the first 21 days, it's possible
within those 21
to get
days,
COVID.
it is possible, because this is something where the way the vaccine works, the vaccine is sort of like a coach. So it's enabling, or it's like a teacher. It's enabling your immune system to be able to respond and build up your response to an attack. So within the 21 days, it is possible for you to get infected. But after the 21 days, your immune system will have built up the strength. So it will be able to recognize the virus, if at all you get attacked, and be able to kill the virus. So after that, you get that level of protection. Now, the catch is, as long as there's not a lot of the virus around, because it is still possible. That's why we talk about the percentages, the 70% or the 80%, because if you do get overwhelmed, you get a lot of virus, then of course you do not have enough of an immune system to kill every single one of the virus particles. So you get that protection after the 21 days. That's the period.
Okay.
Yeah.
I hope that has come out clearly for our viewers. What we now know, now that we've had the virus in Kenyan bodies, for lack of a better expression, for the last 2-3 weeks, what do we now know about most common symptoms? What do we know about those who should get the virus, those who shouldn't get the virus? Are you able to give us more details in regards to those specifics now?
Who should get the vaccine, you mean?
But who should get the vaccine? I beg your pardon.
So the way in which the strategy that has been rolled out is that we are looking at who are the most vulnerable, and also who do we need to protect the most. So slightly different. So in phase 1, we were talking about giving it to health workers and teachers, the people who are frontline, and to our uniformed forces as well, and also people who are in what we call congregate settings, that is the prisons, where there's going to be crowding. So prison officers, prisoners as well, people who are in remand and so on, our uniformed forces and health workers, so that those get the first level of protection. Phase 2 is where we now talk about those who are the most vulnerable, those who, if they were to get infected, will be most likely to get severe symptoms. So we talk about those who are elderly. So in our setup, we talk about 50 plus, and then those who have other underlying conditions where the immune system is going to be weak,
and that's expected to be from
they need protection.
June?
And that should be from June. And this is we phased it that way, but it's dependent on when we receive the vaccine. Now, one of the things we have to realize is that there isn't a vaccine available. A lot of the more developed countries bought a lot of the vaccine, and so we're struggling to get supply. And so under the mechanism that we're working under, we're getting these batches as they're released from the factories.
Tell me this, and this is news. We've seen other media houses reporting this. We haven't done so yet. We're trying to verify this. But we're hearing of the possibility of another vaccine being offered at facilities in the country, specifically the one that was manufactured in Russia, Sputnik. What can you tell us about this, Dr. Aya? Has that been approved for use in Kenya?
The short answer is that particular vaccine is still still requires regulatory approval. So the whole thing is quite complex, because remember that there's no vaccine available for sale. So all the vaccines that we have are under what we call emergency approval. And there's quite some complex bit of the indemnity and so on that needs to be put in place, the regulations and so on. So that one is still under consideration by the regulatory authorities, specifically the Pharmacy and Poisons Board.
Okay, and the long answer? Oh, you're gonna leave,
the long answer would be even longer.
Even longer than that?
Longer.
Okay,
yes.
let me bring Dr. Mbajo, who's also still here with us. Dr. Mbajo, you know, a section of Kenyans are asking tonight, this sounds like last year all over again. We're talking about a third wave. They're worried there could be a fourth wave, a fifth wave, a sixth wave. When will this end? What does it take to end a pandemic? Because we can't live under these conditions. It's, you know, loss of life, crazy hospital bills and disruption to our economy like never before. You know, is there an end in sight to all this?
Well, we definitely hope there'll be an end in sight because we can't continue to live like this. But what are the things that it would take to end? One would be to have a significant proportion of the population vaccinated so that more people have protection. The other one would be to find treatment that is effective. Okay. So we know that so far we don't really have effective treatment. So that may be one of the issues. I don't know if you can hear me okay?
Yes, we can. Carry on, Dr. Ari.
So one of the things is either effective treatment or getting a significant proportion of the population vaccinated. So I guess, Dr. Ari, it's a good thing you're here. We want a vaccine. We want it quickly. And I guess it's for Kenyans that when you have the opportunity to get vaccinated, people should really go for that vaccine.
Dr. Mbajo, does it then make sense to have a plan to vaccinate 30% of the country in the next 1 to 2 years? Should we be looking at 60, 90% of the country if we really want to get out of this?
That is very true. Planning to vaccinate 30% in the next 2 years does not make sense if we want to beat the pandemic. I guess that figure is arrived at not because it's the best for us. It probably has to do with logistics and availability of the vaccine. But if you look at the countries that have managed to vaccinate a significant proportion of their population, and I guess the best example would be a country like Israel, where they vaccinated most of their population, they're reporting very few cases as is. So I think for us, it's really to try whatever we can to make sure we get as much vaccine available as possible and in the shortest time possible as well.
Okay. Let's switch gears a little bit, Dr. Mbajo. One question to you before I bring Dr. Aya back in. And it's a difficult question to ask, but hopefully it will help our viewers learn a bit more about how they can stay safe. What are you noticing are the most common underlying conditions that lead to COVID-related deaths? And how do we handle that to ensure that those who have those underlying conditions can be as safe as possible to prevent further loss of life?
So actually from the beginning of this outbreak, there are certain things that have been noted to be, the most significant risk factors for having a bad outcome, such as severe disease or even death. And this is not said so as to scare the people who may have these conditions, but just so that they can also take certain precautions to try and stay safe until, they are fully vaccinated and we have this pandemic under some control. So if we look at the sort of characteristics of those who've died from this disease, some of the things we notice, those who are older, so above the age of 60, for example, those who have underlying conditions like diabetes, heart disease, chronic lung disease, and kidney disease. So if someone has those conditions, it doesn't mean you're going to die. So it just means that you need to take extra precaution to ensure you prevent yourself from getting infected. So make sure you do not leave your house without your mask. Make sure you're not entertaining groups in your home. You're not going into public gatherings, because if you get infection, then the risk of getting more severe disease is a little higher.
Okay, Dr. Mbajo, thanks so much for that. And I'll be coming back to you because I do have a few more questions for you. But also to let you know that the reports that we are receiving regarding this Russian vaccine approved in Kenya, what we're being told officially is that the Pharmacy and Poisons Board say that they've authorized it for emergency use only. Vaccine has not been given market authorization for sale. Thus, it cannot be advertised. This is what we've received. Official communication from the Pharmacy and Poisons Board is that they have been looking at this Russian vaccine. looking at it to authorize it for emergency use, but not market authorization. That means that it cannot be sold, and thus it can't be advertised. So be aware of that in case you see adverts on social media on the same. Dr. Aya, you've told us a little bit about the crucial sections of society that need to be vaccinated, first phase or first round, second round, etc. Talk to us about those who should not think of vaccination. Who do we know should not be getting vaccinated at this time? What conditions might they have, allergies, etc.? Help us clarify that.
Okay, so just to clarify in terms of who should not get the vaccine, so the number of 30% is actually quite a good number for the following reasons. So those who are aged under 18 are not eligible for the vaccine. So that's about half our population. So 50% of our population are not
knocked
eligible,
out on that basis
already. So yes, so you're left with the other 50%. So we have said that the people who are aged over 60, who are about 2.5 million people, I think those will get the vaccine, plus all the people who are working, frontline workers and so on. So the 30% actually covers a good proportion of people who should get the vaccine. So demographics for most African countries favors us compared to the West, where they have an elderly population and therefore more people require the vaccine. So far, the large categories of, broadly speaking, of people who should not take the vaccine are, for example, those women who are pregnant, for example. You require medical advice so that you can weigh the possibility, should you take the vaccine or should you wait out the pregnancy? So it's a risk benefit assessment that you need your doctor to tell you. Now, in terms of the allergies, there are people who perhaps have got and this is a very small number, of people who have had a vaccine previously and reacted to any vaccine. So you need to alert whoever is going to give you the vaccine that, hey, I've had this reaction, so they can check against the list of ingredients for the vaccine to check whether you're allergic to that. Other than that, there was this talk about eggs and so on. The particular vaccine that we have, the AstraZeneca one, does not have any egg in it or any egg component, and therefore that is not a factor to take into account. So other than that, there are people who have depressed immunity. So those will be people who have had, for example, they're having renal dialysis or have severe cancer, for example. Those people need doctor's advice to figure out what is the risk-benefit ratio.
And are you then asking these questions when people go to get vaccinated? Should people consult their doctors before they go to get vaccinated? I'm just trying to think about possibilities. You hear a lot of stories, Dr. You hear stories of people saying, take a paracetamol and an antihistamine before you get vaccinated to prepare your body for those side effects. What's the truth?
Not really necessary. By the way, you do want a reaction, huh?
Say that again.
You do want a reaction.
I don't want a reaction.
You want a reaction, and this is why. Whenever you get some kind of a medicine, or you want to know that there's some uptake. So you get a needle prick, for example. So some people will say, "Oh, take a paracetamol so that you don't feel pain. You'll still feel some pain." There are things that you can't prevent that much of. So you want to know that at least you've gotten the injection, that you're feeling a little bit of pain. Okay. The following day, you're going to get these mild symptoms, perhaps of fatigue, some muscle pain, and so on. You want that to know that yes, your immune system is working. These are reactions you're getting that say that your immune system is waking up and is doing something. It's reacting to that dose that you got. So if it's all silent, you start to wonder, gosh, why is your immune system so quiet? So what's going on? Why aren't they waking up?
So those who are listening tonight are beginning to wonder whether they had thought they are fine because they have no reactions, but you're now saying they shouldn't be worried.
Yes. But you always want to know that your body has acknowledged. When you receive something, you sign and say received.
Yes.
It's that kind of a thing. You want to at least know that, yep, things are working.
Okay.
Yeah.
As we think about that, many viewers are asking us about the fact that if by the time the second dose comes, it's from a different manufacturer, or they just want to switch to a different manufacturer, should they think of that? Hold on, Dr. Aya, as you think about that. Dr. Mbajo, let me have you back on. First, let me get your reaction, Dr. Mbajo, to the news that Pfizer might be working on a treatment to prevent severe COVID infection. What are your thoughts about that? Do we have anything locally that's close to that for now? And would that be a breakthrough in your view?
So having a drug that actually works for COVID-19 would be a breakthrough. As you know, we don't have very good treatments for COVID-19. For those who are severely ill, we are able to give some drugs called steroids. We try to prevent clots, but beyond that, there aren't very good treatments for COVID-19. So having a drug, especially one that can be taken orally as a pill, would be something that is very useful. Having said that, we must also realize that they're still in very early stage of tests for these particular drugs. So it means right now they're starting the very early human phase trials to determine what is the right dose of this drug, how does the body interact with this drug. So in just a few people, and if they're found to be safe and they're able to get what the right dosing should be, then they go to larger human trials, and there they enroll probably a few thousand or a few hundreds of people and do these studies and then look at outcomes. So it may still be a ways out before we actually have a drug that's useful, but it will be a significant breakthrough if we're able to get that. And I mean, these are things that we've noted in certain viral infections. As you said earlier, the particular group of drugs that's being tried is similar to drugs that we use in treating other viral infections, for example, HIV and the rest. And just to be clear, so that people don't misunderstand this, it doesn't mean that now someone can go and get HIV treatments and start to use them for COVID. Those have not been shown to work in COVID. So we'll wait for these drugs. We really hope something comes out so that there is hope of preventing severe disease.
Okay, thank you for that clarification. So what is the call to action to Kenya for Kenyans tonight? In the past, when we've hosted you, there was a time when you would say, if you test positive, stay at home, monitor yourself, etc., and follow the protocols. There was another time when medical experts would tell us, if you feel anything, rush to a hospital, see a doctor, get your oxygen levels tested, etc. What are you noticing, particularly about this third wave, that you tell Kenyans, if you feel this and that, do this? But if on the contrary, you feel something different, then take a different course of action. What's your advice?
Okay. So most people, again, will get mild disease. So most people will have no symptoms, and then beyond that, you'll have a large number of people who will get mild disease. So if someone has no symptoms or has very mild symptoms, maybe a mild running nose or a mild sore throat, someone can actually stay at home. The only people who we do not encourage at home are those who have significant risk factors for more severe outcomes. So if someone is diabetic, for example, and is older, if you have mild symptoms, you probably want to have the doctor have a look, check your oxygen saturation, so that at that point they can then tell you whether you can stay home or not. For those who stay home, what should they do? And I say this because we've seen people take all manner of concoctions and buy all manner of medications at home. So one of the things we have to note is that at this point, for those staying at home, there's really no drug that will make you better. And many of the drugs you take could potentially have side effects and harm you. So if someone has a sore throat, home remedies like you could gargle some salty water, you could take some, what should they not take for COVID at home? We don't want someone taking antibiotics for COVID. Remember, COVID is caused by a virus, so antibiotics will not kill a virus. There's something that has come up recently, which is a drug we use for parasites. We call it ivermectin, and people are buying it and stocking it. It does not work, so do not take ivermectin at home. There have been studies that have looked at this, and again, we do not have evidence that it actually works. So avoid taking steroids at home, because we know if you don't require oxygen, taking a steroid is actually shown to worsen the outcomes. So let's avoid medicating with those things while at home. You do not want to cause yourself harm on top of the COVID. But while at home, stay active, do some exercises at home, take a balanced diet, get some fresh air, some sunshine, get enough rest.
Okay.
So that's what you should do if someone is staying at home.
In 30 seconds...
Okay, could I finish on that one?
Finish, go ahead.
If someone gets chest pain, if you notice any difficulty in breathing, or if the symptoms keep worsening, then it is important to get to hospital as soon as possible.
Okay.
Yeah.
When should one get the test? There's been a discussion whether you need to get the test or just get checked for all your vitals. Would you say when should one say I need a COVID test right now?
So if someone has concerning symptoms, so you have this homa, so to speak, that is very severe, you're getting a cough that is worsening, then it's important to get the test so that, we know how best to monitor and manage you. In the past, everybody who had contact would be rushing to test, but the truth is, if you have contact, then quarantine at home, because in case you've been exposed, you do not want to expose other people. And if you develop symptoms, then go for a test. So don't just rush for a test just because you were with someone who tested positive. Quarantine, and if you develop symptoms, then go for a test.
Okay, I know I said finally, but one more finally. I've been reminded about the question about children and flu. It's been going around. If you check social media, everyone's complaining that their kids have this flu it's stubborn. It's not going away anytime soon. Could there be any link with that and the third wave?
So we probably don't have a very clear answer to that.
Okay.
We know that around this time, we usually have a lot of colds and coughs. Some of it we found to be caused by the virus that causes flu, and other viruses that are known to cause these symptoms of, a respiratory infection. In some of the cases, we've had children in schools or teachers in schools who have tested positive for COVID. So again, for children, many of them may get a small running nose, and we've seen that going around a lot in many of the schools. It's only that we have not systematically tested to tell us whether this was COVID. So if someone luckily children have clothes, so maybe right now it's not so much of a concern because they're home and you can think about, reducing transmission if that was the case. If someone has a child who has very severe symptoms that's worse than what we have been saying, then it's important that they are checked and that they get a test so that we know how to monitor going forward.
Okay, Dr. Mbajo, hang on. I'll have the last round of questions for you, but let me bring in Dr. Aya, and I've got some questions from viewers. I'll be putting that on the screen shortly. But Dr. Aya, first tell me this. You now have another appointment with the needle in about 8 weeks from your first dose. What happens if you're not able to get that second dose? Or what happens if you feel that there's a new vaccine in town and you want to go for that one instead? And I know I've crammed many questions in one, but how long are you protected for when you finally get both doses? Let's start with those ones.
With those questions, okay. So first of all, right now we only have, apart from the Sputnik, we only have one type of vaccine that's available in the country. So when it comes 8 weeks now, I'll be taking the same vaccine, and it's advisable to take the same vaccine. So under the mechanism that we're under, I think there are 2 or 3 types of vaccines that we can get. The good thing about the AstraZeneca vaccine that we have, and I'm not advertising them, is that from a health system perspective, it's a good type of vaccine because you can keep it in the fridge. The Pfizer one requires minus 70 degrees. We don't have that kind of infrastructure in our country. So there are different considerations to take into account if we are to receive any of the other types of vaccine in terms of infrastructure, in terms of training, and so on. The strategy is to give out, we received 1 million doses, is to give out all the 1 million to try and vaccinate as many people as possible.
For the first round?
For the first round.
Or first dose?
First dose.
Okay.
And then we expect to receive another batch of vaccine in April. So within the 8 weeks, we'll have gotten additional doses to be able to do the second round and continue doing phase 2.
But we have seen countries where the second round is postponed because you suddenly realize you have this great demand for vaccines, so you choose to use the supply for the second dose to vaccinate more people. Is there a possibility that by June or whenever we could have so many people now interested in getting the vaccine that those who got the first dose will be told, stay with that for now, because at least you have some protection.
And it's not a bad thing, because we know that the longer you take between the first and the second dose, the better the overall level of protection that you're going to get. So the reason for spacing it out at 8 weeks or 12 weeks and so on, really what we're looking at is a health system consideration. We don't want you to forget, that, oh gosh, when did I take this thing? Was it 4 months ago, 5 months, whatever. So that's part of the consideration. But really, the longer you take between the doses, the better the overall protection in the end.
How long is the overall protection for once you have both doses?
Once you have both doses, you're looking at 90% plus.
For how many months?
So we do not know whether this is going to be a single lifetime kind of a vaccine, similar to the way you have for yellow fever or measles, or whether it is going to be an annual kind of a dose like the way we have it for flu. So at the moment, what we're trying to do is control the spread of infection the way we have it now.
Okay.
Yeah.
Wow. I hope we'll know soon, because some are saying next year.
We will, because the vaccine, people started being vaccinated when? Earlier this year in January and so on.
And late December, I think.
Late December and so on. So within a year, we're going to start to get data that looks at how people have been protected. Will another wave emerge? Yeah.
My goodness, a pandemic, who would have thought? Let's look at those questions. This is what Kenyans are asking tonight. We're going to put a few up. We can't pick all of them, but Jane Nambuko wants to know, Dr. Aya, is the vaccine safe for people who have had organ transplants or are on immunosuppressants? Please note that question, Dr. Aya.
Yep.
Let's take a look at the next one. And I'll look at 2242 as well for those of you sending SMSs. Paul Muya says, it is immaterial to talk about a vaccine to a majority of Kenyans who will not even come close to the vaccine. Talk and emphasize more on prevention of spread, especially kids and more so teenagers now at home, while the virus is wild on steroids. And Dr. Mbajo, maybe you can note that one. What happens where you can't get the vaccine for the next 6 months? What do you do? Bob Mwangi is asking, is it safe for people with pre-existing medical conditions like asthma to get the vaccine? All right, and one more. Karuma Kennedy, what if my immune system rejects the vaccine? What if I take the first dose and miss the second dose? Will it be of use asking for a mere locals? Okay, I don't understand that last part, but Karuma Kennedy, your question is important to us. That's why we put it up on the screen. Dr. Aya, where do you want to start?
Well, yeah, I mean, the first question is people who are immunosuppressed in any way, no. They should get medical advice before taking the vaccine. So anybody who's on immunosuppressants, I guess you're taking medicine to keep your immune system down. The vaccine is meant to stimulate your immune system, so there's a conflict there. So you do need your doctor to advise you on should you take the vaccine or not. But if you just walk in and say you want it, you should not. I think there's a question there about that most Kenyans will not be eligible for the vaccine. Why should we emphasize the vaccine? The vaccine is part of one of the 2 or 3 things that we need to do. It's not the only thing. So the mask gives you up to 80% protection if you wear a mask all the time, and you do your physical distancing as well. So if you combine that, and then you're somebody who would possibly suffer severe disease, and you get the vaccine, then the protection levels are very high. So if you're somebody who, even if you got COVID, you are most likely you are going to be asymptomatic. You're young, otherwise healthy. So if you got COVID, maybe you sniff a little bit and then you're fine. So in those circumstances, maybe the vaccine is not for you. Okay? Maybe.
Okay.
If it is available, take it, because you also end up protecting. Remember, it also lowers transmission. You end up protecting those who are most vulnerable. And that's why there's this staggered approach where you want to target those who are most vulnerable and those who are in the front line. So that's why it's that way. So it may look like, 2022 is far away, 23 is far away, but it's about availability of the vaccine. And if we can get more of the vaccine, certainly there'll be an acceleration in terms of giving out the vaccine.
And someone is asking about if their body was to reject the vaccine. Have we seen any cases like that?
No. Now, I guess maybe the way of talking about that is that people who would get a severe adverse reaction. Now, so far from the trials, it's about chances are 1 in a million. Okay, 1 in a million. Now, to put that into context, our road crashes, we kill about 250 people per million. Okay, so the vaccine is 250 times safer than being on a Kenyan road.
So an interesting way to put it.
Yes. So if we manage to roll out all the vaccines we want, we expect 2 people in this country will suffer some adverse reaction out of the millions of doses that we're going to give. So that sort of would give you an indication that the vaccine itself is very safe, not fairly safe, it's very safe. So that rejection would mean that you have an adverse reaction. We're training the people giving the vaccine on how to manage any adverse reaction. So you would get treatment for that, and likely you would survive, and therefore you would not take the next dose. Perhaps if it is something which has been found to be peculiar to this particular vaccine, then maybe you're eligible for another type of vaccine.
Okay, and Dr. Umbajo, I think there's a question I had already shared with you, but let me also add this. A viewer is asking, if you have a young person, 16 and diabetic, would you say they are high risk? Because there's that underlying condition, but there's their age, which is quite young. And another viewer is asking, should we keep oximeters at home? You've told viewers not to stock up antibiotics. Ivermectin, the name of that drug, which we keep seeing in the WhatsApp forwards, you've said don't keep it. It won't help. What about oximeters and thermometers and all these gadgets that are being touted as what you must have in your house if you can afford them?
Maybe just to start with the first comment, I think, about emphasizing all the other prevention measures. So I think one of the things we must realize that for this current wave, over the next month or 2, the vaccine is unlikely to make a significant impact on spread of disease because we are still only vaccinating a few people. So for us to actually bring down the number of cases immediately, we need to continue with all the prevention measures. So people must wear masks. We must avoid gatherings. We must think about staying home as much as possible and only going out where is necessary. So for the immediate or the very near future, those are the measures that are going to make a difference in terms of how much this disease spreads for now and until such a time that we have managed to vaccinate a lot more people. There was a question that's a difficult question about the younger person who is also diabetic. So this is someone who does have risk, so their risk categorization is higher than for a younger person of the same age. And you'd say that for such people, at such a time when more vaccine is available, then again, we should get them vaccinated. At this point, we've seen a few children or some children who've gotten COVID, and most of those are children who've had significant underlying diseases. So children who've had cancers, children with underlying heart disease, for example, are the ones we've mainly seen get most sick with COVID. So children who have significant underlying factors like, heart disease, for example, certain types of cancers, are children who are at considerably higher risk than other children. And when more vaccine becomes available, that's a group that we should think about vaccinating. Having said that, we do not have too much data about the vaccine in children. There are countries that are rolling out some studies for vaccines in children, and hopefully that data is available soon so as to inform us on how best to go about these children. You asked the other question about what we should keep at home. So if available, as I told you before, most people may not have symptoms, and again, many people will only have mild symptoms. So asking people to keep oximeters may only work for a small proportion of Kenyans who are able to afford them. But if available, and you have someone who is at risk for more severe disease who's staying at home, then you may want to monitor their oxygen saturation so that it tells you whether it's going down and you need to get to hospital. Thermometers are really just to tell you about the temperature. We know that most of our patients with COVID actually do not get a fever. In our studies, we've all seen fever in less than 20% of people who have COVID, just about 16%. So you don't have to feel bad if you do not have a thermometer at home. Many people report that they're feeling some fever, but if available, then yes, those can be used.
Okay, you're doing a lot of justice to all those forwards we've been getting on WhatsApp, especially over the last couple of days. Now, to our viewers, I must apologize. We won't be able to handle all the questions. Otherwise, we would stay here past midnight with the good doctors who have very busy days tomorrow. And I promised I wouldn't keep them here till late. I've already broken the first part of that promise. So let me take a few more questions, some coming in via SMS 22422, and then we'll have to wrap it up there. But remember, here at Citizen, we'll keep getting doctors here to answer your questions until we are through the worst of this. So don't worry, even tomorrow and in the days to come, you'll get the advice that you need here. Let me read a few more questions. Someone says, my aunt in the United Kingdom got COVID 15 days after her first vaccine. And unfortunately, she transmitted the same virus to 2 more people who lived with her. How is that possible? Also, someone wants to know, when I recently got COVID, how long should I wait until I take the vaccine? That's an SMS. Let me read 2 more. No name or where you're writing in from, but you say, how effective are zinc tablets in preventing COVID-19 infections? Should one take the vaccine if they're breastfeeding a 1.5-year baby? Again, they're not telling us where they're writing in from. George Mungai wants to know, if you're COVID-19 positive, can you get vaccinated? I think we've been told no on that already. And one last one, should one take, is it safe for a 60-year-old with hypertension to get the vaccine? Okay, let's start with you, Dr. Aya. Any of those you want to tackle?
Yeah, sure. So we had talked about the getting COVID despite having the vaccine, because we said it takes about 21 days for your immune system to be up to speed in terms of giving you the protection. So it is possible during that period to get COVID. The second part to that is that if you test positive for COVID, then you should wait for the quarantine period to end before you get the vaccine.
Even if you test positive after the quarantine period, for those who still test positive for a long time.
Yes, so you wait. Yes, so you wait at least 14 days your quarantine period. Then you can get the vaccine.
Okay.
Okay. So that's the advice that's been given. For the 60-year-old with hypertension, they are eligible and they should get the vaccine.
Okay.
Yeah.
Okay. Dr. Mbajo, I think there were 1 or 2 that you could tackle.
So one, there was the question around, should you take zinc? And I guess with that, there's a question of people want to take vitamin C, people want to take vitamin D. So in the early phases of the trial, I think there was some suggestion that zinc could reduce entry of the virus into cells. But subsequently, there have been a number of studies that looked at zinc in terms of preventing progression of disease or reducing progression to severe disease, and it's not really been found to have any impact on that. So much as some of this may not necessarily be harmful, remember they're not useful. So if something is not useful, you don't have to take it. So that applies to zinc, and it applies to vitamin C, vitamin D as well.
Okay.
I don't know if you had another question.
Maybe the last question is one that a viewer sent in. Please ask both doctors whether they've been vaccinated. Dr. Aya has said he has. What about you, Dr. Mbajo?
Yes, I was. I think I was vaccinated before Dr. Aya. Okay. I was vaccinated on the first Friday. Yeah.
What has your experience been like so far? Because one viewer wants to know, when I get vaccinated, what are the do's and don'ts? What should I avoid? Is there anything I should be aware of? What's it been like for you, Dr. Mbajo?
So when I got vaccinated, the first day I had a bit of pain on my arm. I was feeling a little tired, but subsequently that reduced. What should people do or not do? Remember, as Dr. Aya said, even after the vaccination, for some time you're still at risk because your immune system is still building up to be able to prevent. So you must still continue to wear your mask. You must still continue to avoid crowds and other gatherings, and you must continue to take all the precautions and take care of yourself. You must encourage other people to take vaccine and reduce the amount of anti-vaccine propaganda out there so that you get as many people going for the vaccine as possible.
Avoid the propaganda, I think, is your parting shot. Dr. Aya, let me get a last word from you. And I asked Dr. Mbajo this already. When are we going to be over this? What will the end look like? What does it take for Kenya to declare the pandemic over and done with?
I think so the first thing about the do's, you asked about the do's. When you're going for the vaccine, dress appropriately. We had all this thing of going there and you dress a certain way and we can't access your...
There's a challenge actually happening on social media right now, unfortunately.
Yes, already about that. So you have to dress appropriately for that.
That's interesting.
Yeah, I think we're faced with 2 issues. One of them is that it's a global pandemic, and therefore we have to move with the rest of the world. So we're going to have a situation where some countries will have vaccinated the majority of their population. There'll be other bits of the world which will not have. And I think there has to be a discussion around that. I think that so far, because of our young population, we are favored in a way, but also disadvantaged in the way that, as Dr. Lois talked about, that we don't have enough equipment. We're not testing for the variants. It's very expensive, this testing. We spent billions and billions of shillings on testing, and our health system is fairly constrained. So we're going to have to, I think it's going to be a slow sort of stepping out of the whole thing. I think if we look at history, we are looking at 2 or 3 years of this. We're in our second year.
2 or 3 years from today, not from last year.
Yes, we're in our second year now.
Oh, okay.
Yeah, so I think that if we move and we do some of the things, and we're learning all the time. So I think that by next year we'll have pulled out of a lot of it. We've learnt a lot. And then thereafter, it depends on how the rest of the world reacts.
My goodness. Okay.
Yeah.
We're going to have to leave it there. I have more questions, but our time is fast spent. Dr. Lois Ombajo, infectious disease specialist, University of Nairobi, Kenyatta National Hospital, thank you so much for your time. And here in studio, Dr. Richard Aya, a member of the National Task Force on COVID-19 vaccine deployment. What an enlightening conversation, illuminating, if I can say so. I've learned a lot, and I hope you have at home as well. Remember, here at Citizen TV, we endeavor to give you all the information you need on COVID-19 vaccine, virus, variants, how to stay safe, to debunk some of the myths that you're hearing as well. So in all of our programming, you'll be seeing a lot of sessions like this where you can send in your questions. So keep sending them in. 22422 has been the SMS line, and the hashtag NEWSNIGHT. Nevertheless, even as we wait for everyone who wants to be vaccinated, let's keep following those measures. Social distancing, let's wear our masks, let's monitor ourselves, let's keep our loved ones safe even as we do that. Thank you so much for tuning in and for sending in all your messages. On behalf of the whole team that's made this broadcast possible, my name is Wahiga Mwaura, and my sign language interpreter tonight has been Joki Shege. Need I say, stay safe, even as you have a good night, and we'll see you soon. Thank you.